Welcome, friends. My name is Kim, and I've been an emergency attending for the past 10 years. Please join me in a day in my life. Hope you enjoy. I usually wake up around 3 p.m. I work at night, so I wake up in the afternoon. I prefer to wake up to light before the sound alarm and put on bossa nova music. Then I splash some ice cold water on my face to wake myself up. I've been drinking San Francisco Bay Keurig K-Cups in the morning for many years now. I've never really gotten to fancy coffee, and I find that these K-Cups have the perfect amount of caffeine for me. Next, I am mixing up vitamin C powder, which I probably don't need, but I am still paranoid from the COVID days. To that, I'll add creatine to improve strength performance, and Great Lakes Collagen, which I found has helped greatly with skin elasticity and joint health. I use my trusty handheld mixer to mix everything up.
So today is Wednesday, and I'm gonna take my supplements, and I will make a list of all the supplements I'm taking. But overall, this is a pretty good stack. Fish oil, coenzyme Q, multivitamin. There's some B12 in there. There's some psyllium husk for constipation or to prevent constipation. Vitamin K, vitamin D, and apple cider vinegar gummy.
I take my coffee outside to enjoy a little bit of sunlight. I frankly don't get a lot of sunlight when I work because I work at night. I try to take this time to simply enjoy the coffee and not think too much about the day ahead. This is honestly my version of meditation and the most peaceful part of my day. I've been eating the same breakfast before work for many years now. I find that meal prepping has been game-changing because it saves me time and keeps my meals simple and healthy. Today is a weightlifting day, so I'm putting on my squat shoes. I'm pretty lucky to live only a 10-minute drive away from my local gym. While driving to the gym, I'll have a banana pre-workout, and I'll listen to a podcast or a book on Audible. I'm always happy when I get to the gym, because getting there is half the battle. Today, I'm doing heavy hack squats. I've learned a lot of great lessons going to the gym over the years. In contrast to the ER, where things can be pretty unpredictable, the gym is a place where hard work and effort gives you an almost guaranteed outcome. It taught me the lesson that hard work and discipline pays off. The gym is also a place where everyone comes to better themselves in some shape or form. And I love to surround myself in that type of positive energy. I log all my progress in the gym on an iPhone app called Heavy. I had a great weightlifting session, and I got all my adrenaline out. Now it's time to put on my scrubs to go to work. Okay, I'm about to head off to a 12-hour night shift. I feel pretty awake, I slept pretty well, so that's a win. And let's go. Just got to work and it's completely dark outside. An ambulance pulls in while I'm walking to work. I wonder if it's gonna be my first patient. Okay, starting out my night shift and walking towards the ER. Tons of ambulances. It's the beginning of my shift, and I'm already dealing with pretty complicated patients. In between seeing patients, I look up the latest evidence on the management of spinal cord compression. Sometimes it feels like I spend up to half my shifts documenting my charts. I am very lucky to be working with outstanding colleagues, with whom I usually discuss difficult cases in the middle of my shift. Oftentimes in the ER, especially since the pandemic, apart from acute care like strokes and MIs, we are treating chronically ill patients that are difficult to disposition. Some of these patients are coming from skilled nursing facilities that can no longer take care of them. Here, we are discussing how to best manage a patient in a persistent vegetative state. It's the end of our shift, and we surprised our colleague with a birthday cake. It's small moments like these that make our job a little more enjoyable. Everyone else has gone home for the day, and I'm finally done with my charts. I am finally done with my day and ready to go home. As I walk out of the ER, I try to avoid directly looking at the sun. I find that it affects my sleep. After my shift, I think about all the patients who I have taken care of that day. And I hope I have taken care of them well, but sometimes I worry that they may come back to the ER sicker. I find that walking on a treadmill while dictating my journal helps me process my thoughts. And it's now my day off, and I'm gating boba with my wife. I found that it's small pleasures like these that help me balance my stress from work. Then, we found a new local ice cream shop that we're gonna enjoy together. I think I'm gonna try this new Lilikoi flavor. Thank you so much for joining me in a day in my life as an emergency attending. If you like this video, please click like and subscribe. Thank you.